Good morning um, to the Orgasm Hour Q&A. I'm Dr. Suzanne Mulvehill, and here to join you this Sunday morning on answering questions regarding female orgasm. And today we're going to talk about, oh, you're the one. Okay, I just saw your message. So yes, I got a question this morning from a woman who's here with us, and regarding adahinia, inability to feel female pleasure, and meaning one can orgasm, but one cannot feel the pleasure of the orgasm. Meaning the body has a physiological response. There may be flushing. There may be um, uh, I'm trying to think of the word, contractions, uterine contractions, as if the orgasm is actually happening, as the orgasm is happening, but the mind is like, I don't feel anything. I don't feel anything. Why am I not feeling anything? So I thought we would just start there with that type of difficulty experiencing orgasm, and I'll start with sharing a few stories and my own experience having had that problem. That um, I would say, after seeing 4 sex therapists, my feeling is they didn't understand what I was talking about, and I really didn't even have a term for that. So I'll just share first that I met 2 women in London when, with the first time that we had a conversation around this particular topic, and I was doing a 7-month program in London on a topic called orgasmic meditation. That there's some controversy around that, but beside the point, that's what I was doing. A 7-month, it was CP14, it was called. So I went back and forth to London for 7 months, and there were 2 women there. I sat on a picnic table with them, and I said, I have these orgasms. I've had them like this for years, and I can't figure out like why I can't feel anything, and why the therapists don't seem to know what I'm talking about. Like, no one seems to know what I'm talking about. Excuse me. And the first one said, I know exactly what you're talking about. When I was a teenager, I was having sex with my boyfriend, and I know I orgasmed. I know that I had a pleasurable experience. And his mom came in and shamed me, and I haven't had a pleasurable orgasm since. So that was one woman's story, and I can continue with that in a few moments. And then I'll share the other woman's story. It goes, yeah, I know exactly what you're talking about. I just have these contractions. I have the orgasm. I can't feel anything. There's actually, I found on Reddit a thread called Ruined Orgasms. And I was shocked to see that there are 500,000 people on this ruined orgasms thread talking about their orgasms being so-called ruined. So what I can tell you from my personal experience is I struggled to have orgasms to begin with. Like when I had one partner, from the old school. I married this man. We had sex before we got married, and then we got married. And while I was still dating him, I made a decision one time that I was going to feel whatever there was to feel, that whatever he was going to do, I was going to feel it. So he had gone down on me. I was giving me oral sex, and I had this literally like mind-blowing orgasm, right? And I was like, holy shit. I was in my 20s, and I was like, what was that? Like, and I want to say that it took me beyond my system's comfort zone. Like, my own system had trouble alchemizing what I had experienced. So, when we continued to have sex, and mind you, I was with somebody who I was trying to control his alcohol and drug use. So I was already codependent in the relationship. And then this orgasm controlling thing kicked in too. It's like, well, I just can't go out of control like that. Like, I didn't have any language for this. I didn't understand what was going on. And so I started going to sex therapy after we got married, and we had our first child, then we had our second child. And I would have I don't know, I think I had that one orgasmic experience, and then my orgasm started to become controlled. I'm just going to use the word controlled, where I could have it and I couldn't feel any pleasure. And I was like, what is this? So Anyway, I ended up in sex therapy, and after the first sex therapist, somehow I was able to start orgasming again with my partner. It's almost kind of hard to believe because we were in such a contentious kind of relationship, but I was able to start accessing orgasm again with him, and intermittently. Um, but I had this feeling that continued to feel like a feeling of inadequacy, like there was something wrong with me. And I see that in so many women on the Reddit thread, like, I feel broken. I feel broken. And women, I'm noticing women saying they feel broken from even their one woman just the other day spoke about her boyfriend cheating and how he made her feel like she was broken. So this feeling that we carry around of feeling broken, that's another whole story, but I think that comes through generational trauma of women in general in our society from the work that I do and evaluating history. Um, but staying on the track of this orgasm problem. So my own orgasm when I would masturbate, I would find myself in the same situation, meaning, okay, that wasn't pleasurable. Let me try that again. Okay, that wasn't pleasurable. Let me try that again. That wasn't pleasurable, and I found it to be kind of looking for the holy grail. And you feel free to comment, like if you're here and you um, want to share on anything. I'm happy. I see the chat right here, and I'm happy to comment as you might see something you want to talk about or ask another question of something that I'm sharing. Um, anyway, I went through this same experience for a number of years, and then in 2000, I found myself in Sex and Love Addicts Anonymous for what I felt I was addicted to, like this searching for this orgasm, and I would look for that. I would say even in a compulsive kind of way. And so anyway, I went through that period of time, and then really in 2018 was when things started to shift for me, when I did that London thing and got rid of the shame. So the shame was really holding a lot of my problem. And it was when I put myself on a structured how to use cannabis. Cannabis is really what unlocked my orgasm for me. Not just my orgasm, but my whole story around something being wrong or feeling sexually inadequate. All of that dissolved, for lack of a better word. It went away. I became whole, like sexually whole. And it came through, like, I would say the sexual wholeness came through being able to access this orgasmic state and orgasm in it. So I started using cannabis. I was with another. I don't know how to integrate this with my story so that it's not all choppy. That you're following, that you can follow me here. But I put myself in 2018 when I did the orgasmic meditation, and I got the shame left my system, literally, when I went and I want to say even confronted the shame. And then the next level was I heard about cannabis working and helping women orgasm, and I wanted to try it. And I found the first time that I used it, I used too much. It was before I was going to try an orgasmic meditation with this man, and he brought over cannabis. And what I found that cannabis could do, as someone who was totally against it, mind you, I was totally against it. I was using cannabis with this boyfriend, or this was after the fact. In 2018, when I tried it for the first time after college, right? So I'm talking about like 40 years later. And I had panic attack in college when I used cannabis. It was like, hey, come use this cannabis before physics class. And that was not a good experience for me. But anyway, what cannabis did for me, it took me back to where my trauma started getting lodged in my system. Like, it took me on a trip. And I was like, oh my God, that's where I was being abused. Like, I was able to identify the exact moment where my husband would tell me there's something wrong with my brain, like right after I would surrender after a long fight. And it just took me back to that exact scene. So I realized that cannabis could help me get access to my inner thoughts and my inner self. And I developed a structured program to train myself. And I recorded like 500 sessions of meditation. Some of my meditations are in my YouTube library. I'm not sure that's public right now or not. But if you wanted access to it, I can give it to you. I created some of my own meditations to start retraining myself. And I knew it came down to retraining my brain, like that my brain had developed a pattern of to keep me safe, for lack of a better word. Like my brain was actually trying to keep me safe, whether it was keeping me safe from trauma, whether it was keeping me safe from going out of control. I had to work with my brain. And I had to learn how to fantasize. And that's what cannabis, I would say it taught me how to. The first time that I orgasmed again with pleasure while I was in my own training program was when I went back to the scene with my husband, giving me pleasure or through oral sex, like I shared from when I was 20 or so. And I recreated that entire scene with my mind, telling me exactly the way I wanted the stroke, at the pace I wanted it, and being so present to that experience in my mind that the orgasm happened on its own. And I burst into tears. Like I was like, oh my God, like it's like having access to that is, like you had shared about the ice cream, being only allowed to have the flavor of vanilla when you know that chocolate and strawberry and all these other, the 32 flavors of Breyers is available, or Baskin Robbins, I think it is here in the United States. Like, there's all these flavors are available, and why can I only have vanilla? And I think having access to our orgasm is just as important as having sleep. I think it gives us something that we need for, at least in my personal experience and in my personal search of, it gave me something that I couldn't get anywhere else. I could go get a PhD. I could get a master's degree. I could raise 2 children. I could be I was an elected official. I can do anything really that I want with my conscious mind, but I didn't know my unconscious mind at all. Like I had no access to her. So I had to train myself on when I would start to go into using cannabis and going into the altered state. My brain was like, all right, how long do we have to do this? Like, how long do we have to hang out in this, this do nothing kind of state? Like my ordinary mind was so much in control of my entire life. I had no access, and I was actually afraid. Like people say, oh, I'm afraid to go on a trip. I'm afraid of like what might happen to me. And I understand that. Like I never did Quaaludes in high school. I never did LSD. I never did any drugs because I never wanted to. I wanted to say, like, I was afraid of that. I don't know how else to say that. But once I got to know, like, so I'll just share with you. So what I would do when I first started this practice was I would, prepare the setting. Like the setting is really important. Not having to rush, number one, having time, feeling what comes up, like preparing the environment externally and internally, like preparing a ritual for going into an altered state. And back then I was using a vape pen, and I would take a hit and then I would lay down, and sometimes I would just cover my eyes, and I would have to put it's like I would start going there, and I would have to put my conscious mind. It's like, okay, we're going to give you a movie to watch. So I would give her some kind of interesting movie to watch so that I could access this other part of my brain. And one day I met her, she just like showed up, and it's funny, I'm wearing pink because she was pink. She was pink, and she was all shapes, and she could change into any shape and size, and she was funny. And I found myself like it's like it almost is like watching a movie. Like if you've used cannabis or if you used it the way I use it, or other, I don't know, I can't speak really for other drugs. I have used psilocybin a few times. Um, but I was really with my altered self and one with her. And eventually my ordinary self, who was very modest and very, very proper, she went and tried to lay on a lounge chair. Naked. Like she was like, okay, I want to be like her. Like, so now I feel like they're one. You know, this has been a number of years, 6, 7 years. I went back for my PhD. Like my access to orgasm gave me, I sold my company. I had an international plant business. I sold it to go back to school for my PhD because I wanted to study if women were actually using cannabis to access their orgasm. And that was, you know, my dissertation advisor, who's vice president of my nonprofit, the Female Orgasm Research Institute. His name is Dr. Jordan Tischler. He's a Harvard doctor. And he said it's really me search. Like when we do research, it's really me search. So yeah, all my research is really me search. And I've got a new model for female orgasmic function that's sitting in peer review with the Archives of Sexual Behavior. I'm in the process of submitting another journal article on orgasmic learning and using a framework, like starting to look at how we can access orgasm in a learning type of way. Because my mission really, when I started the Female Orgasm Research Institute, was and still is, it's proven pathways to orgasm. Like it's been, it's a very siloed industry, meaning we have researchers like Barry Komisarek in Rutgers University, who studies fMRI and the brain. He studies the brain of women when they're orgasming. He has found, for example, that women can orgasm that with complete spinal cord injury, where the brain, you know, usually the orgasm goes through the spinal cord, like that's one of the conduits, a main conduit to orgasm is through the spinal cord. And he found that with women with spinal cord injury, that is not the main conduit, that the main conduit is the vagus nerve. So, I mean, that's fascinating, right? That the body would actually learn a new way to have an orgasm. And that brings me to a woman in Oregon. Her name is Rebecca Anderson. She's the petitioner for the state of Oregon to add female orgasmic disorder, a difficulty/disorder as a qualifying condition for medical cannabis treatment. By the way, after 2 years, the state just denied it. We just got notification this week. 2 states have approved it, 8 states have denied it. Which is another story. But if you wanted more information on that, you can go to womenscp.org and join our movement. And you can sign up to lead your state or country or support your state or country in getting 4 conditions of treatment for medical cannabis for women passed, the 4 that got approved in Illinois: endometriosis, ovarian cysts, female orgasmic disorder, and uterine fibroids. So that's a separate story. But going back to her, she had a radical hysterectomy. Her way to, and this is public information, I'm sharing something that she has shared publicly through her testimony and through with research with reporters. She had a radical hysterectomy, and the way she orgasmed was cervically, and her cervix was removed. So she talked about how depressed she became after not being able to access orgasm. That was how she orgasmed. And she said she started dabbling with cannabis and making her own suppositories. And after, I think it was about 8 months of trial and error, she learned new ways. Her body, she learned how to squirt and have orgasm through squirting. She learned how to orgasm clitorally. Her body learned new ways to access orgasm. And then a study came out of the UK right after the state denied it in December of 2024, a preliminary a randomized controlled trial of women with gynecological cancer and treatments and they had what's called acquired FOD, meaning like her, they lost their ability to orgasm. And they used cannabis suppositories, and it talked about how they got their orgasm back with mindful, intentional use and cannabis suppositories. So I could go on about the cannabis because that's my area of research. I'll share a couple of other stories. And if you have another question, feel free. I think there's a few of you here. I want to say thank you for being here and welcome. If there was a woman I interviewed for my dissertation research out of South Africa, and she had been raped as a teenager. She had no ability to orgasm, and she told her then partner, listen, I can't orgasm at all. No masturbation through partnered sex, nothing. And where I'm grateful is that she was honest, because that's another whole challenge and chapter is women who fake orgasm for pleasing their partner. Another topic for another day. But this woman had told her partner, and he said, try this. And he gave her a hit of cannabis. And she orgasmed the first time she used it. They've been married for 15 years. They have two teenagers. They had two teenagers in the house. She said they have to be, I would say not cautious, but aware, having teenagers in the home, being in a country where cannabis is illegal. And they use cannabis before sex every time they have sex. Now, what was interesting about her is when she was asked in my research, question number 6 was, do you have difficulty orgasming during partnered sex? Now, she answered no, that she did not. However, without cannabis, she almost never orgasms, and she almost always does with cannabis, which was the answer for the women who said they did have difficulty. So the reason I'm bringing that up, and what she also talked about, was how much cannabis helped her heal her sexuality. And she said this is coming. It's one of my quotes that I have shared. It's in my dissertation. I've used her quote in some website. I don't know where exactly, but I've used her quote about how this was coming from someone who had been raped as a teenager. So how to be on the same page if cannabis is known to dampen men's pleasure? I just see your question here. How to be on the same page if cannabis is known? That's a good question. Okay. Cannabis is for men, because I'm in the process of writing a chapter for a book, a second edition of Cannabis. It's Cannabis. It's from London's King's College in London. I was invited to write a chapter on cannabis and sex, and my research partner and I are writing this chapter. And here's the issue. So if you look at Amanda Moser's research, Amanda Moser did research on one of the largest cannabis and sex studies with 811 men and women. She found that for men and women, cannabis enhanced desire, enhanced orgasm intensity, enhanced arousal, etc. If you look at Dolly's research in 1979, he too talked about sexual pleasure for men and women. So the men and women studies, when men and women are studied together, there's a study also out of Canada it's called Wiebe and Just, Wiebe and Just. Their study on men and women using cannabis before sex, again, pleasure was enhanced. But most of the research on men alone is looking at it causing erectile dysfunction. Does it cause erectile dysfunction? And the studies are mixed. So that is the spot that we're talking about in this paper of how the research is mixed more so on men and women, where we have research on women. So it really does come down to dose, sensitivity, frequency of use. So there's a study, Smith did this study in 2010. It's an Australian study. I think it was with like 10 or 15,000. And I'm pretty sure, let me just double check this, the Smith 2010 cannabis and sex. I'm pretty sure it was an Australian study. Frequency of use, let's see, I can share my screen even with you. Let me see if I can bring that over. Cannabis and sexual health. Okay, here you go. Okay, so it looks like you can see my screen. This was the cannabis use and sexual health study by Smith et al. And it was 8,500 people who used cannabis before sex. I'm not sure if this was in Australia or not. Yes, maybe not, but there is one in Australia. Anyway, I want to highlight here where you can see daily cannabis use was associated with reporting. Well, I don't really. This is not. This part is important here. Frequency of use was unrelated to sexual problems in women, but daily use versus no use was associated with increased reporting among men of inability to reach orgasm, reaching orgasm too quickly and too slowly. So this is where we see the difference in the research. Let me pull up a Casman study. Now, this study is women only, cannabis and sex. And let me just show you what happens with frequency of use. So already you see frequency of use for women not causing sexual problems. And with this study with Smith, it causing problems with 8,500 men and women. Okay, next study. Let me pull up this one now. This is the assessment of the association of cannabis on female sexual function with the female sexual function index. And here we go. Here are the results. A total of 452 women responded. I want to go down to the most important thing. Women who reported more cannabis use reported higher FSFI scores. What that means is better sexual functioning. FSFI means the female sexual function index that measures the 5 domains of sexual functioning for women: desire, arousal, orgasm, pain, and lubrication. So here, this piece right here. Moreover, an increase in cannabis use frequency by 1 additional use per week was associated with an increase in total FSFI, and a p-value, just from a scientific perspective, if I had to learn this in my research, below 0.005 means it's statistically significant. And what that means is it wasn't by chance, that it was the cannabis that caused this improvement. So here it says here, it improved the total FSFI for desire. That was 0.02, below 0.005, arousal and orgasm, and satisfaction. So for each additional step up of cannabis use frequency, i.e. times per week, the odds of reporting female sexual dysfunction declined by 21%. The method of consumption, or cannabis and Chemnovar type, did not consistently impact the scores or odd of sexual dysfunction. So what's important to share about this study is the fact that we just saw frequency of use being an issue. I'm asking relating to mental intimate connection. Relating to mental intimate connection. Well, it doesn't necessarily dampen men's pleasure, I guess. If you can meet your partner there, I guess my question is, have you used it with a partner? That would be the first question. And if you can share it from your experience of having used it with a partner, I can share it from my experience of having used it with a partner. Or are you sharing it from the perspective of you using it and not your partner? Because like the study for the Banbury study, for example, the one with the gynecological cancer patients, one of their women's complaints were that when they would be high and you in this state and their partner wasn't, they didn't feel like they could really connect with their partner there. I mean, I can tell you one of my most, I don't know what the word for it is, memorable orgasmic experiences was with a guy I was doing a sex practice with. And we had decided that we were just going to use some cannabis. We set the container. The container means the rules, the guidelines for safety for both, because the vigilance center of the woman, they say, now I don't see the research I haven't found this in a research study, but I have heard that the vigilance center of women is stronger than the vigilance center of a man. So a woman will be in her vigilance center and like, am I going to orgasm? I wonder, how am I feel? Like her need to stay in an absorbed state is greater than men's. And that is in the research from 1994, that a woman needs to be in an absorbed state of consciousness. And there's research on women who are in altered states of consciousness. I'm going to read your question. Women who are in altered states of consciousness, who can access altered states of consciousness, are more sexually responsive. And I can show you that study if you'd like. Okay, your question. Is it possible to reach female orgasm without cannabis use? And is this live going to cover this topic? Yes, you can reach orgasm without cannabis use. I can share with you a woman, and I like to share research. Like, I like to share factual information because I find there's so much out there that's not. So let me take you to a few research studies where women have been able to learn how to access orgasm without cannabis. This one particular woman, and it was, let's say, she had vaginismus. She had, let me just tell you first before I start typing. She had vaginismus and pain during penetration. She was 33 and in Israel. And a research study was done on her where she not only, she trained herself through tantric breath work and yoga practices to use her breath to learn how to access an orgasmic state, an altered state of consciousness with her breath and with tantric work. And they measured her, and it was a state that she could control, an orgasmic state, meaning she could go into it, she could orgasm in it, and she could stay in it. They measured it for up to 5 to 10 minutes, and they measured her blood plasma, meaning they could measure that they look at prolactin, and there's certain things in the body, but the bottom line is they were able to measure that her orgasm was, she experienced orgasm through this state. So a lot of the focus, is it possible? So the point, here's the thing. Our society and even the whole diagnostic criteria, the Masters and Johnson, who said in 1966, desire, arousal, if you have arousal, you're going to have orgasm through stimulation alone. And that is the implicit assumption that we in society believe, that if you have sexual arousal, orgasm is right around the corner. And that may be the case for men. But for women, that model, that sexual response model, makes an implicit assumption that a woman is going to go into an altered state of consciousness in order to orgasm. So I'm in the process of, like I shared, bringing up, I have a peer-reviewed journal, a journal article on a new model for females, because my personal belief is that model that actually builds all of the treatments and it builds all of the dysfunction on a model that actually doesn't match women. So in your question, is it possible to reach female orgasm without cannabis use? And is this? Yes. So, and it may be that it needs to be practiced through non-genital stimulation first, meaning training the body and mind to access orgasmic states without touching the clitoris until one learns how to access altered states of consciousness. So another study by this, and I'll show you this, let me find this particular study, because we have a half an hour. So let me give you the study if you want to read it. It was by a guy named Faust, Dr. Faust, non-genital stimulation. And are you aware, the person who asked, 58, are you aware that women can orgasm through non-genital stimulation? I mean, that is known, like, factually, and it's in the research. And have you ever tried it? I guess that would be one question. Case study. Let me show you this study first, and I'll put it in the chat. Here we go. Case. Okay. The study, and a case of female orgasm without genital stimulation. So this talks about what happened for her. Prolactin surges after orgasm as an objective marker of orgasm quality. The increase after her non-genitally stimulated orgasm indicates that they induce the same physiological changes as genitally stimulated orgasm and result from top-down processing in the brain. So if you're interested in this, we'll share it in the chat right here. And there's another question I'm going to answer here. That's that particular one. The disconnection is what I'm asking about. You don't seem to be in sync with the chat questions. Well, there was just another chat question here that I had from someone else about, is it possible to reach orgasm without cannabis? So the disconnection is what you're asking about. The question is, what's creating the disconnection? Is it in your mind? Meaning, is it in your mind? Is it in your body? Is it both? Is it where, like one woman, for example, we'll go back to this disconnection. One question I have for you is your body locking up? And are you going past your body's comfort zone? Do you stretch beyond your comfort zone? I'm going to give you my own example of this, of what I found. So when I was using the cannabis, I had a realization that I would get tight in my gut, and I would continue to still stimulate my clitoris. And one day I had a realization that I was violating my own body's limit, that tightness was a sign that I was going beyond my limit. And it took me back to being molested as a kid, where my regulation system somehow got broken, where I didn't know when my body was trying to tell me, this is too much for us. You're taking me beyond a limit that's comfortable. So that is the point I want to talk about in terms of the disconnect is your body, can your body trust you? And this is not going to be solved necessarily in this 1 hour or in the 20 minutes that we have left. It's a practice to teach. So what I did when I had that realization that I would get tight, because my kid, remember I was telling you the part of my brain, my kid would be in my gut being like, there she goes again. She's going beyond our comfort zone. She doesn't respect me. She doesn't listen to me. So you have a little kid in there too. Like we all have a kid in us. And is your kid feeling safe, or is your adult self going beyond your kid or trying to keep? So what does your inner child need? And you might be like, oh my God, we're going into therapy now. And and it's not that I want to go into therapy, but the disconnect for me, this was a large part of my disconnect, is my own system didn't trust me, that I was going to go beyond. And I'm going to give you another example of something I heard from a woman who shared about not using her voice. Her husband or her boyfriend, she said, put the lube on her and start jackhammering away. Now, does that sound like a woman who was A, ready to be penetrated, B, felt desire to be penetrated? Probably not. So how is her orgasm and how is her pleasure going to feel if she just violated her own system and not knowing it, unknowingly letting her partner put on the lube and jackhammering away? So the first thing is having your body knowing that your body is completely safe, that your inner child is the part of you that I don't know what's causing the exact disconnect, but there's something that is not aligned, and looking for it in the body. I would have visual healing sessions with myself where I felt like there were rusty gates closing my, my whole pelvic floor was closed, and I had scaffolding inside, and I saw these, I don't want to say visions, but visual representations of what I saw being redone in my body. So if you were to see your body, and even with or without cannabis, like using the cannabis or not using the cannabis, but taking the time to go inside yourself and say, okay, where might the blocks exist? Where are they? What are you feeling? Are you going beyond your own limit? And I think that, taking me back to what happened in my first orgasm, like it took me out of my limit, and then I started to try to control it. So I want to make sure, is there, you can relate to me if you have something else here about the disconnect and how to look for signs within your body that may be showing you where the disconnect is. If you were to visualize your body, where is the disconnect? Is it in your mind? Is it in your body? Is it in both? A woman would tell me, another woman I interviewed would tell me, who was working on her practices, and she said that when she would get close to orgasm, her brain would tell her, just so you know, you're getting ready to orgasm. So she would jump out of the pleasurable sensations, and her brain would like alert her that she was about to go into, like, about to lose control, which clearly her system was not comfortable yet with going out of control. So it's a real pacing issue of not going beyond your own body. I'm going to look at your question, own body's comfort zone. Okay, thing is interesting. Okay, let me see. This is effectively what I'm learning, but this Q&A is at a running level when people need to know the baby steps. How does she know the breath? Yeah, well, these, I mean, we have an hour right now to talk about this. How does she know the breath work? How, none of this. So here's the thing. We're starting to like turn the, I'm writing a paper called Orgasmic Learning that starts to list all these different ways, all these different silos of research. Because for the woman here, you had asked about reaching orgasm without cannabis, like hypnotic induction. You can Google hypnotic induction. Hypnotic induction is another way women are accessing non-genitally stimulated orgasm, because I mean, typically they're not going to be in a hypnotic session stimulating their clitoris, right? There's research going back to the 1970s on that. In fact, somebody posted on my LinkedIn yesterday specifically about that. So you got hypnotic induction. There's another piece. I'm taking all these pieces of research and putting them into a paper where we can say these are all ways that women can learn to orgasm, and then we can develop treatment protocols using breath work, because right now it's fragmented. The industry's fragmented. That's why you're not seeing, can you find this? The research is fragmented. The treatment is fragmented. Oh my God, there are literally no validated treatments for women who, there's only one validated treatment, and that's from 1970s, called directed masturbation for women who never experienced an orgasm. There are no validated treatments for women who have difficulty orgasming during partnered sex, women who have acquired zero. So you'll look at the first line treatments and you wonder, why are there no treatments? Because that's just where we are, in a stalled focus on female orgasm. Okay, let me see these other questions. How does she learn about these things? Exactly. Where to begin learning about altered states of consciousness, as most of us just read, and it's in our head. You're right. You've got to train yourself. That's exactly it. I'm actually starting in the fall. It's going to be with cannabis, though. It's a 12-week Becoming Orgasmic with Medical Cannabis, with a medical cannabis doctor. She's an OBGYN I'm going to be doing the guidance on the training, on the rituals, and the structured settings, and doing one-on-one sessions with women, because this is the first time we're offering it. It's based on my structured program. I have 500 recordings that I recorded myself when I did this retraining for myself. Because cannabis is one of the ways in, right? I mean, it is a way in. As a meditator and a yoga practitioner, I couldn't get what I needed. The cannabis took me a level in where I could actually start quieting the thoughts. And that's what women told me in my research, like the metal walls. And we see cannabis as listen, I was totally against it. Let me read the rest of your questions. Where to be guided? Exactly. Where to be guided into the feeling. I'm going to share with you my, the meditations you can try. They're on, the old laundry. I don't know how to send them to you directly. No. I was talking about the disconnect. The chat is, it's disconnected in the presentation. Do you mean that you're not hearing me when I'm talking? I don't know if that's what you mean. I'm not sure if that's what you mean. My microphone, I have a microphone right here that's on. But yeah, so what I want to say is you found the exact issue, is that right now not necessarily going to find a treatment program on the breath work to access orgasm that I'm aware of, because I don't know if anybody teaches it. It's not a validated treatment, because it hasn't been studied. Other than that one article about the tantric breath work, that one's been shown. I can show you hypnotic, and this is where in 6 years, I've actually had Female Orgasm Research Institute. I opened it in 2018. So we're going on 8 years. I've went back to school in 2020 for my PhD. And for 6 years, I've been working on this exclusively. So, and I see the silos of research and the fact that they're just, look, we petitioned 12 states to add female orgasmic disorder as a qualifying condition for medical cannabis. 2 states approved it, Illinois and Connecticut, and 8 states denied it. And 2 states haven't even responded, Pennsylvania and New Jersey. So we are dealing with I almost think sometimes is female orgasm a bad word? Like, I'm actually working on helping the culture talk about this, even though there's 150 million downloads of porn a day and men thinking all these women are orgasming. We have it's up to 72% of women in the Diagnostic and Statistical Manual of Mental Disorders. It's up to 72% of women having orgasm difficulty. So another place to start with the breath work is also Kundalini. Kundalini, I became a Kundalini trainer. I don't practice it as a trainer. I could go back. I have some videos on using Kundalini breathwork, because Kundalini breathwork for me changed everything. Like, in one of the practices, I can share with you a couple of practices, and you can begin to feel how it works. But it's there's one called straw breath. So when you would just learning how, again, to access the altered states of consciousness and knowing when you can get into that state. So it's straw breathing. So literally you would close your eyes, and if you want to close your eyes with me, and you make a straw with your mouth and breathe in all the way up from your clitoris, like bring it up through your vagina, right? I'm going to keep my eyes open while I guide you here. And just get settled first if we're going to go ahead and do this. Take a deep breath. Make your straw. Lift your shoulders and round them back. And feel if you feel, because I can feel sensation. I've trained, you can sensitize your body to start feeling sensation. Another deep breath in. Shoulders up and round in the back. Hold it in. Breathe it out. Notice sensation. So practice, you can practice, and we'll do this again next week. I'll be back at 10 o'clock next Sunday. Breath work in. Round up shoulders. Hold them up. You can also breathe it out with what's called lion's breath. We'll do a lion's breath. And lion's breath, you can keep going. And open your mouth wide. Stick out your tongue. I use that breath at the end of my yoga practice. That's a Kali breath, a lion's breath. So that's one breath practice you can use. Another one are these a sniff breath, where you do like 3 or 4 sniffs in. And I like to lift the shoulders while you do these sniffs. And again, it's always about lifting the energy. So when you do the sniffs, you lift the energy up. I can feel that in my body, because I don't know, can you feel that in your body? I'm curious if you can feel that, because I've trained myself to feel it. And there's a few practices in my from 4 years ago when I was doing Kundalini about spinal flex series. And again, training the pelvic floor, training the spinal, your spine to have more sensitivity. And that's also part of the research. I can pull up Or do you want to just stick with the breath here? You know, but that breath work, and then I'm going to share with you. I have, if you go to Dr. Suzanne's library, I'm going to make that. I think it's private right now, but I will make it public. There's fountain breathing in there. There are 2 meditations that I created for myself. 10 minutes later, you read. We ask. And because I see it right this second. Okay, let me just see if we're here. I see it right now. I see it now. See if we're just okay. Now I understand what you're saying. 10 minutes later, you read. So I saw it pop in and I read it, and I don't know if that timing matched or if not. You can let me know, because I don't know if these are things we're able to do something with YouTube or not, because it would be nice to be fully in sync. Top chat. It says top chat, but it's live chat. Okay, it should be live chat. We should, because I responded exactly when you wrote it. So be interested in seeing if it's 10 minutes later, and if it is, I'm sorry. And so. Okay, so I have a library of 2, and starting to train your mind. Meditation is also known to facilitate arousal. And think about it. So arousal happens when there's blood flow, when there's tension. And I mean, tension can be self-induced. Tension, self-judgment is a form of tension. Self-judgment is a form of self-threat. Your body interprets, oh, do I smell? Oh, do my labia look okay? Oh, all of those types of thoughts. What your brain hears is threat, 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 and it tightens. So arousal does not work when blood can't flow through tight blood vessels, which means there's a form of relaxation. Now, as we become more aroused, it's different to have a self-induced form of tension and a bodily tension that actually rises with the arousal. Because self-induced tension, like, am I going to orgasm? Oh my God. If any of those types of thoughts come in, those are for sure creating disconnect. So these are a couple of things we're surprised it went so quickly, but I'm happy to come back next week with you. And you're welcome to come on. I'm looking to make this a weekly Q&A. I think Sunday morning kind of suits the soothing environment for orgasm, right? It's not like Monday night after work or Saturday when, at least, and you're in Australia, so it's Sunday night there. We're in a little bit of obviously a different time zone. But work with the mind. That's working with the chemicals of the mind. That's where the work was. For me, it was working with the mind through the breath, through, what I wanted to say also, there's research on a woman who had pelvic floor. Let me find that for the woman who asked about reaching orgasm without cannabis. Pelvic floor. She did pelvic floor movements and orgasm. And is same by the same researcher. Let's see if I can find it here. Here it is here. I'll give you this. Woman's orgasm determined pelvic floor muscle contractions. That's not the one. This is one of them. You can read, if you wanted this piece, if you like looking at research. I'm a researcher, so I like to give you the facts of what has been researched and studying this day in. I want to say day in and day out for not just the 6 years of becoming a researcher and getting my PhD, but for 30 years of the problem that I had. So, that's I don't want to spend next time I want to see if I can have some of these research articles ready for you. But then again, it's kind of hard to have them ready because the topic we're talking about actually brings them up to life. But the hypnotic induction is another one. So you can Google hypnotic induction and female orgasm and this researcher Faus, Pfaus, and you should be able to find it. And you can email me, info@femaleorgasmresearch.org, and I will respond to you. Thank you for joining. I see someone else just popped on. And, knowing that you can get there through non-genital stimulation, and I kind of feel, I'm beginning to believe and have a hypothesis. That's why in ancient times, for those of you that might have gone to Pompeii or have studied any of the goddess research, for example, in Pompeii, there's a place called the Villa of Mysteries, and the Dionysus rituals, where it says right on the placard that women would enter orgiastic rituals. And these were all very well known. The Dionysus rituals. There were other types of altered state rituals that can be entered through ecstatic dance. For example, that would be one way to practice, is to go to ecstatic dance and get yourself familiar with your altered state. But yeah, becoming familiar, getting to know your altered state, and when you're in it. It's kind of like, to me, it's the other side of the mirror. Like, this is my ordinary consciousness, and I know what the other side, I answer. Wow. Okay. So it does take, okay, 10 minutes. God, or that's kind of, wow. I'm sorry. I don't know why it's taken so long. It's not, I don't know if there's anything we can do about that, but becoming familiar with your altered state. And there's a study here by Costa. Let me show you this last one. Costa, altered state and sexual responsiveness in women. Here it is. I wrote and I answer about 5 seconds after you asked if I could see. I didn't get your response until exactly when. Now I see. But there are plenty of women who can orgasm without altered state, yoga, cannabis. Why does it work for them? That's a good question. We haven't studied that. Why does it work for them? Some women, I can tell you in my research of the women who said they don't have orgasm difficulty, which 52% said they did have orgasm difficulty during partnered sex, and 48% said they didn't. And I'm talking about 387 women overall. 202 said, yes, we have orgasm difficulty during partnered sex. 187 said, no, we don't. And if I were to show you the graph, which I could get it, but I don't have time to do it right now, that the women who didn't have orgasm problems, they're going to orgasm with or without cannabis. They just orgasm more frequently. That's it. The women who did have orgasm issues said, yes, I have an orgasm problem. The largest group of them almost never orgasm without cannabis and almost always orgasm with it. So there was statistical significance in cannabis improving orgasm frequency, ease, and satisfaction for women with orgasm difficulty. And that was 50 years of research on that. There's a book from 1970 called The Sexual Power of Marijuana, about 4 women who learned to orgasm using cannabis and didn't need it once they learned. And why didn't they need it once they learned? Because their brain developed the pathways to connect the sensation. I don't talk about partnered sex. I mean, yeah, I understand. And putting yourself in an altered state of consciousness and learning how to access. So let me show you this one study, and then we're coming to near the end. This study here, let me share my screen. This is a great study that talks about women being more sexually responsive who access all states of consciousness. And here we are. Altered states of consciousness are related to higher sexual responsiveness. It doesn't say in women, but essentially it's in women. There was 116 altered states of consciousness led to profound changes in the sense of self, time, and space. And I think we have undervalued the altered state of consciousness as a state that is actually necessary for our well-being. I really do. I mean, I'm coming to believe through my own experience, and because I just felt like something was missing in my life without my ability to orgasm. I really did. There was just something missing. And it gives a sense of wholeness to be able to access these states, orgasmic states. So this was it. So if you look here, female vaginal intercourse orgasm was further differentiated as with and without concurrent clitoral masturbation. overall sexual responsiveness was related to greater body awareness and lesser time and space awareness. Satisfaction, desire, and arousal were especially associated with less time awareness in women. So here's my question with masturbation. Let me go back here. Oh, I thought I lost you. With masturbation, are you able to go into a fantasy and stay there? That's a question. Can you go into the fantasy and stay there? Can you hang out with your sensations? Just be in the sensations, like hang out in sensation. No focus on orgasm, just hang out in the orgasmic state. Like that would be the practice. I mean, I'm not sure that would be the practice, like for whatever. You mean masturbation? Yeah. Can you hang out? You don't have fantasies. Have you tried having fantasies? Because I didn't have any fantasies. I didn't even know I had capacity to get them. But fantasy happens when you get to a certain state of consciousness, whether it's it has to do with brain waves. So if you can, I mean, again, if you want to do some research this week, I would research about what brain state do fantasies exist, because I'm going to go back to cannabis. Cannabis is what taught me how to have them. Cannabis is something that can give you access to them. Now you can get there with meditation and with breath work and with other things, obviously, because we know from the research that women are able to have orgasms with, some women don't need what we need, women who've struggled, right? They just don't need it. I don't know why. It's just not a non-issue. I don't know why. But having fantasies, like where's your mind when you're masturbating? Are you thinking about what you're feeling? Are you thinking? Because if there's any thinking, usually I can tell you that means you're in your cognitive executive functioning of your brain. You're in the part of the brain, your ordinary consciousness. An orgasm doesn't happen in ordinary consciousness for women. In fact, the definition of female orgasm that they came up with, by Cindy Mested is her name. There was a group of researchers that got together in Paris in 2003, and the definition for female orgasm for women includes orgasm being an altered state of consciousness. So that means we have to know how to go into an altered state. And I believe it's not like because I mean, my first sex therapist was like, I'm going to pop off here in a minute. Let me just finish my first sex therapist was like, oh, you just have to pop into a fantasy. And I'm like, how do I do that? What do you mean pop into a fantasy? No, it doesn't work like that. You can't just pop into one. You've got to emerge into one and hang out there. And that's where most of my orgasms happen, when I'm in fantasy or I'm listening to music and I have my eyes covered and just listening to certain music, music with words. If I listen to music with words, I'll start wanting to sing. Doesn't work. It'll take me off track. I have to listen to, in fact, there's a certain, it's called hypnotic, there's a certain group that I listen to, and there's a certain tape of hypnotic music that it's high vibration, and I put the headphones on or the earbuds on and I cover my eyes and I allow myself to go with the music. And that's what I'm talking about for you to have fantasy, like to just be with the music, hang out, not with am I going to orgasm? Like take that off the table. Just be with your body. And if you want to touch your breast, start with your breasts. Like, do I feel sensation here? Do I feel sensation here? If you have a partner, play a game. Like, do it body tracing? Where do I feel sensation in my body? Like focus on sensation, especially if you're struggling with orgasm, especially if you're struggling with not feeling pleasure. Start with sensation and getting out of your ordinary mind with music, with closing your eyes, with covering your eyes, like really going inside. So I could go on with you all, like really, like I am incredibly grateful that you showed up today. And this is our first Orgasm Hour Q&A, like going with those of us who have struggled with this, right? Or are still struggling. Like, and I mean, for me, porn doesn't work. Like some people, for porn works to have a great orgasm. For me, my mind is too occupied watching what I'm doing and then judging it and evaluating it, porn doesn't work for me. Knowing what works for you, like finding what works for you, exploring, like opening up what works for you. Cannabis works for me. But I can also orgasm with the music, or I can have an orgasm and hang out in an orgasm state but just that little bit, for me, the little bit of cannabis can take me in that state pretty quick because I've trained myself how to get there. So it's training yourself, training your mind how to get there. Oh my God, I'm sorry to say goodbye because I really enjoyed you being here and the fact that we're live. And we'll come back. For those of you who'd like to join again next Sunday, we'll be back at the same time. And if there's anything in during the week, I'm going to create you can write to me on Facebook. That's where I post here as well. And you can just write to me on Facebook or send me an email. I just want to try to keep it all in one consolidated place so I don't lose track. So I'm thinking Facebook might be the best place. Or you can write comments right in here in YouTube. All right. I wish you all a great day. I thank you for watching and for participating and hopefully feeling even hopeful that you can have it. It's just like how to sleep. Your body knows how to sleep. Your body knows how to orgasm. Your body knows how to orgasm. What we have to do is get our mind out of the way. That's it. Research about orgiastic rituals in Pompeii and how women used to go into ritualistic altered states, training themselves to go into altered states since ancient times. We just stripped that all out of our society. It got stripped out. Okay. I'm going to sign off and wishing you a great day. So thank you again. I'm going to write you a quick note. Thank you. And I want to see if there's that one. I would like to find that pelvic floor. I don't know if you want any more articles. Okay, we'll sign off. So thank you again for being here and hopefully see you next week. Bye.